And so just want to, first of all, express our appreciation to have you here. Thank you very much. We will be providing a recording of this session that will be located on the Rethinking Schools website at the County Office of Education. This is also translated in Spanish for anyone who would like to access this session in Spanish. So Michelle, if you could go ahead and provide information to our Spanish speakers.
Thank you, thank you. Bienvenidos. Este webinar se transmite simultáneamente en español. Haga clic en el botón de interpretación de idioma que aparece en su pantalla si desea escuchar esto en español. Muchas gracias a Marta Bitton, que es nuestra intérprete esta noche. Gracias. Thank you.
Yeah. So before we go forward, I just want to make note. I think for many of our parents, you're more than aware that we have already had 3 sessions that we've been involved in specifically to provide information to our parents. One on October 10th, one on October, October 10th. I forget. Then the next week, the 3rd, I'm going to get my dates wrong. But anyway, October 20th, as well as last week. So we've had a lot of opportunity. Some of what you're about to see will likely be duplicative, but some of it is new. So I'll ask Dr. Santora to move through this fairly quickly. And Lisa, thank you so much.
Well, hi, everyone. Thanks for having me here. We'll jump quickly. There is new information because things always change with COVID, and we go through the data right before we launch into our presentation. So you can jump to the next slide. So this is just our cadence of meetings with the schools. We believe one of the keys to our success in Marin County, especially with the school reopening, has been having strong communications with all levels of the school community, from parents to school staff to our labor leaders. And we also engage students early on in these processes. So this is our key, is having clear and effective communications and always seeking feedback from the parent community. So you can jump ahead. So this is newly updated. If you saw Dr. Willis or I present earlier today, we would have reported that we're in moderate levels of transmission. We probably both qualified that because we've been seeing increasing numbers of cases, and the CDC does not work on the weekend. So there's a lag in updating the data. So now we are back into substantial transmission levels, which is where we always have been. Nothing changed with the virus transmitting. Actually, it should be going up over the next couple of days because of the increase in number of students who are becoming infected with COVID-19. And just a reminder for everyone that the CDC does recommend, when we are at substantial transmission levels, that we wear masks in indoor public settings where we don't know if everyone is vaccinated or not. So when you're out in the public indoors, it is recommended, whether you're vaccinated or not, to wear a mask just to protect yourself. And I just wanted to highlight Florida. I lived in Florida for many years, and I know that looking to Florida and seeing it having very low case rates. But what you may not have followed in Florida over the past couple of months was how many hospitalizations and deaths and cases they had during their Delta surge. And so, yes, they did acquire natural immunity, and that is beneficial to the community to have both natural and acquired immunity, but there were many lives lost. Their hospitals were very, very stressed, and their healthcare system was stressed. And that's what it took. So it was significant suffering that has now does have Florida in a moderate level of transmission. And that's something that we've been able to be protected from in Marin County through our policies and the work to create a safer community for all. So you can jump ahead. So this is where we are. This is not unexpected. We're seeing an uptick in cases. It's as people move indoors and there's Halloween and other gatherings. This is the uptick that we're seeing. If you remember, this time last year, we were very sheltered, and many students were not back in school, and parents and kids were not gathering with other parents and children. And so this fall is very, very different. We're out playing sports and other things, but that does increase the risk of transmission. And you can jump to the next slide, and you can see where we are different. If you look, the left side is January of this year. We have been seeing an increase in the percentage of cases that are among the 5 to 11 years old. It's a significant population in our community, and it's an unvaccinated population in our community. And viruses are very smart, and they find unvaccinated and unprotected members of our community. So it's not surprising to see that. You can jump ahead to the next slide, which will be our school dashboard. If you've been following this, you'll have seen that this is a significant jump in cases over the past 2 weeks. Again, all of this is expected. We now have over 275 cases we've investigated 20 cases a day related to students who were in school during their infectious period. Fortunately, we are still seeing very low rates of school-based transmission because of the protections and layers of protections we have in place in the school setting. And just to point to the left-hand side of this, where we are reporting our vaccination rates, we'll be adding another box. We are going to be reporting both the 5 to 11-year-old vaccination rates, as well as the 12 and above vaccination rates. And that will be new, possibly as early as this Friday's update on the dashboard. You can jump ahead. So our mask mandate did end. We were in moderate for the 21 days that were necessary, with 80% of our total population vaccinated, and with our hospitals stable. And so that's what allowed us to end our mask mandate. It's important to remember that in schools, there is still a mandate. It's the order of the state. So anytime students are present, everyone must wear a mask. It's really important to remember that unvaccinated residents should also be wearing a mask in all indoor public settings. That is the state order. So only vaccinated persons in Marin County are allowed to enter facilities without their mask on, unless it's a school with students present, or some of the other sectors that still require a mask. And just to be prepared as you travel throughout the Bay Area, that there are other areas that have different mandates. So it's best always to have a mask on hand. Jump ahead. So just wanted to reinforce the sports and extracurricular activities guidance. We are not changing this, especially as we're seeing the uptick in cases among that 5 to 11-year-old population. We have a testing cadence that's recommended for unvaccinated persons. Everyone playing sports indoors and the spectators must be wearing a mask. And the only time that they can't wear a mask is when there's a choking hazard. And you can jump to the next slide and see the list of sports that are identified as potential choking hazards. And just to note that basketball and volleyball are not considered sports where there is a choking hazard. So teams playing in Marin County should be wearing, most sports should be wearing masks indoors. And again, all spectators should be wearing masks indoors. Jump ahead. Good news is, unlike last year, we're headed towards school performances, and we're really excited to hear music and demonstration of performing arts back in Marin County. But just to remember that these are also high-risk activities because of exhalation that does occur with singing and other dance performances. And we see every setting as an opportunity for risk reduction through multiple layers. And so we're going to jump to the next slide. So preparing for our school performances, we still recommend that we limit participation to fully vaccinated individuals. If there are unvaccinated individuals participating in this higher risk activity, they should be tested regularly, and the guidance is linked here. With school performances, unlike with sports, this is an area where performers should maintain 6 feet distancing from each other, really seeking to optimize ventilation, and then also just having smaller groups when performing in ensembles. And you can jump ahead. And again, spectators, students are present, so they should be wearing masks indoors. Masks must be worn during rehearsals, including dress rehearsals, according to the CDPH guidance. Performers must wear their mask when not actively performing. But if it is a performance while they are actively performing, only the moment that they're on stage performing, the performers may remove their mask if they are fully vaccinated or have a negative antigen test on the day of the performance. That being said, many schools may continue to require masks, and we are fully supportive of performers both in mask and not in mask. So mask is the best way to protect from any COVID transmission, up to 70% protection. Jump ahead. School-based testing.
Hey, Lisa, before we move on, could I go through those? I have some questions that came in advance that were mask related. So
Perfect
what's
timing.
the off ramp for mask mandates in Marin County schools? I'll ask all the questions, and then if you can integrate them. All right, what's the off ramp for mask mandates in Marin schools? Does Marin County intend to rescind the mandate for high schools, public and private, as soon as the state allows? Does Marin County intend to immediately allow field trips, visitors on campus, and inside community events? Will future mask mandate exemptions only apply to vaccinated students? how will Marin County handle religious and medical vaccine exemptions? And if students opt to not get vaccinated, what are the alternatives? I.e., will they have to wear masks, regular testing?
So our plan is to stay aligned with the state of California. We don't have an additional mandate in place in Marin County for schools. So we are fully aligned. When we started the school year with the introduction of Delta, we did initiate a recommendation for masks being worn outdoors, and that is no longer in place. And so we will be fully aligned with the state. I'm anticipating the state will reevaluate masks when we hit mid-January, after there's been sufficient time for the 5 to 11-year-old population to be vaccinated and for the state to have an opportunity to look at case rates for the 2 weeks following the return from the winter holidays. We know that the winter holidays, just the nature of private gatherings and travel itself, will increase the risk of COVID-19 transmission. So we'll see the behavior of this Delta variant in the winter, which again, it's a preferred season for COVID. And it'll be interesting to see what the state says around mask mandates. So what we saw locally is when we had 75% of our population not fully, we had 75% of our population fully vaccinated. Countywide, we still saw a surge of the Delta variant. So I know earlier, before school ended last year, there were conversations of certain vaccination rates in schools that would allow the ending of a mask requirement. I have not heard those conversations start yet at the state level. And again, I expect that the state level conversations to happen in January, after we see the case rates following vaccination and winter travel. And then the other question was around field trips. So field trips are still allowed. They've been allowed since the beginning of the school year, and parents are allowed to engage in field trips. It's strongly recommended that all parents who are participating in school activities be fully vaccinated. That's not a requirement, but a strong recommendation, just like teachers should be fully vaccinated. And that it would be up to the school level if they allowed non-vaccinated parents, but we would discourage that. And there is another masking question.
If a student opts not to get vaccinated, what will the alternatives be? Assuming there's no state mandate, which there may be at some point.
So we're anticipating a state mandate for vaccination for 12 and above. We do not know, I have not heard any conversations at the state level yet about the 5 to 11-year-olds. And so we also are expecting there'll be exemptions for students, and that will be posted on the shotsforschool.org website, and they have not posted additional information. It'll be different than the current exemptions process, because it's not a legislated exemption, it's a governor ordered exemption. So there will be a difference. So I think there'll be more flexibility in the exemptions for COVID-19. And then if it's unvaccinated, I would expect that the unvaccinated students would be required to wear a mask when indoors, just like the current order. So that would be what I would expect to be the next phase, is that when masks are allowed, and this will be a challenge to manage and in the school environment, but when masks are allowed to be removed in the school environment, I would expect that it would still be required for unvaccinated students to wear masks indoors. That's again, that's my expectation, but that's not been defined yet.
Sure. Lisa, there's a question about the data. When will the data be available school by school related to vaccine rates? And so go ahead.
No, we expect that the schools will be posting their own data. So school by school, we have cumulative data on our dashboard, but in our guidance, we have requested that all schools post their vaccination data. It should be up to date for the 12 and above, since we have a large portion of our population vaccinated and the schools have had time. They should already have their staff vaccination rates posted, but it will take time for the 5 to 11-year-old vaccination rates to get posted. I would expect it would probably take a solid month, and you'll see more data on how many kids have been vaccinated to date. It'll probably take a solid month for schools to have the information they need. So maybe, where are we now? Maybe before the winter break, schools would be able to post the school level data, and we'll review that with the superintendents when we meet with them in December.
And then Lisa, one more. A parent is raising the issue that one of the schools is continuing to require masking outdoors at recess. And so if you could just talk about different schools are able to make different decisions related
Right.
to, right, they can have more strict rules.
So it's kind of, it comes downhill. So you can't be any less strict than the state and you can't be less strict than the county, but you can be more strict. So there are some schools that are continuing to have mask outdoors. We've consulted with some schools. There are schools, especially with younger age children, that they're opting to wear a mask outdoors because of the nature of close contact and just the developmental age of children. But masking outdoors from a public health perspective is completely optional. We have had data from our own start of school that has shown that we do not see significant outdoor transmission, but it's up to the individual school level policy. So we would just refer people back to their school administrator if they have questions around continuing that policy.
Okay, great. Thanks, Lisa. Okay, school-based testing. Sorry.
Testing. So this is another tool that we have that we didn't have at the start of last year. We're going to be meeting tomorrow. We have been leading in many ways with testing, and we're now working to enroll all of our schools in this California State testing program. We are not recommending asymptomatic surveillance testing. We are finding it very, very low yield to test asymptomatic children, but we are recommending 3 types of testing. One is symptomatic testing, which we are doing both through home-based testing, which we'll talk about in a little bit, as well as offering testing on site at schools. And that's one of the advantages of participating in the state program, is schools will have the capability to test children if they develop symptoms midday at school. We also are engaging in response-based testing, where if there's an exposure event at school, we will support the schools and go on site to test students who may have been in an exposed group or cohort. And then we're also going to be launching, and we just started this week, piloting a test and stay program, which is where we have modified quarantine, where students who are exposed at school in a very supervised, structured setting are allowed to return to school. But then now we also have close contacts where they might have been exposed while they're out of school. We're working with some schools who are willing to pilot this and to allow the students back in who were just exposed to COVID-19, as long as they complete daily testing at this point. So we're excited to be moving in that direction, where we're not excluding students from school who are not, we are able to demonstrate through testing that they're not infectious, even if they're a close contact, and we're excited to have those testing options. And by being enrolled in the state program, it gives us access to testing supplies, which is really exciting. And we've also been able to extend our own testing supplies because of the manufacturer has extended the expiration date. So we have sufficient testing for keeping kids in school, and that's been our goal since the beginning. So it's a good thing. You can jump ahead. Your slide, Mary Jean.
Yeah, sure. So just to remind all of you in our community that one of the things we've been doing throughout COVID is, in addition to looking at worldwide, national, state data that in Marin County, we've also made sure that we're keeping information and data about how it's working in our county. And so this slide is updated every single day. So today's data, this is specific to the rapid antigen test pilot. When it talks about schools, it means all public, private, independent, and parochial schools in the county, 116 of them representing 47,000 students and adults. And so you can see here that as of today, actually, we've had 2,391 tests given. So these are the tests for people that have symptoms. And you can see here that there have been 13 positive and 14 inconclusive. So this data helps us get a sense of how many people with symptoms actually are ultimately testing positive. And in addition, we have specific data related to what the symptoms were. And so we're aligning that as well. So next slide, I'm good on that.
I just want to add to that slide that it's really important to remember, if your children are symptomatic, there's other things that are besides COVID. So we always want to prove that it's not COVID first, but there's lots of other viruses, rhinoviruses, other coronaviruses, RSV that are circulating in our community that don't have vaccines to protect us, and why hand washing is always so critically important. And that's something that I think everyone has declined in their practice. So, and this is actually data from this home-based pilot is what supported our decision to end the masking recommendation outdoors is because we had access to testing like we never had, and we're able to demonstrate that we're not seeing outdoor transmission. So again, it's been the data itself seeing very low rates of, even though we're seeing increases of COVID-19 in that 5 to 11-year-old population. If you look at this data, you'll see that the majority of people with symptoms are not testing positive for COVID-19. So again, we're weighing both.
Right.
Increasing COVID, but most likely not COVID.
So Lisa, here's a question sort of related to the PCR antigen test. So if a vaccinated student has cold symptoms for more than 24 hours, is it mandated by the county that the student can no longer produce a negative antigen test and must produce a negative PCR test?
No, we accept both tests. It can be an antigen test or a molecular test. If a home-based antigen test is negative, as long as the student is improving and is fever-free for more than 24 hours without fever-reducing medication, then they can go to school. The biggest challenge we've had is that people test their children find out it's not COVID and a kid's still sick and they're sending them to school a little too soon. So that's been our biggest challenge, but either an antigen or a molecular test is accepted as proof of a negative test.
Great.
Jump ahead. So this is the new chart you'll see on our vaccination website. It's going to potentially be updated today. Today's Tuesday. Tomorrow is Wednesday. It's been a full week already. And we'll be reporting on data of our 5 to 11-year-olds in this new group. So you can jump ahead, and all of our data, every data point that you see on any presentation that Dr. Willis and I provide, except this one, it can be found on our website. It's my go-to place. It's where I am prior to making these presentations. Is just taking screenshots from our website. So you have access to the data that Dr. Willis and I look at. So we had a very successful Super Saturday, just big thanks to the Office of Education, Mary Jane and her entire Rethinking Schools team. They set us up for success. We're at Miller Creek, so thank you to Miller Creek for being a host. And on our Super Saturday, we were at 5 different locations on Saturday, and we vaccinated 2,367 kids. We had no adverse events related to those vaccines. My 2 kids were vaccinated, and a lot of other family members in our public health response had their kids vaccinated. And there's been a little bit of headache and some sore arms, but all kids are doing well. So we're really excited about this early launch, and you'll see a little bit more of the dates that are in the future. And I recommend going. I know some people, there's a high demand for appointments, but if you go to our website today, over the next 2 days, we've been adding appointments, and I was able to share appointments with some of our parents in my school, and they're able to get appointments today. So just go onto our website, and if it's not there today, I would check again tomorrow because appointments are being added by the day. You can jump ahead. And this is just show the effectiveness of vaccines. So this is from our local data where we look at the past 90 days and compare the rate of infection. We look at the rate of infection and the outcomes, both hospitalizations and deaths. And so we compare vaccinated to unvaccinated. And so what we're seeing in Marin, this is Marin County data, it's not national data, is that people who are unvaccinated are 25 times more likely to become infected with COVID-19 in the past 90 days. They're 84 times more likely to become hospitalized and 21 more times more likely to die from COVID-19. And so this is just local data to inform you of how this virus is behaving in our community and still the risk of remaining unvaccinated. And although I just want to say here is if you saw a presentation from me, probably in May or June, we would have said we had around 25% of our cases were breakthroughs. If you look at that dark blue, we're now seeing 75, it's flipped. We're now seeing 75% of our cases are breakthroughs. What's really reassuring for us from a public health position is if this was a year ago, we would probably have 30 people in the hospital right now. And today we only have 2 people in the hospital. And again, it just shows the effectiveness of vaccine and preventing severe disease and hospitalization. So you can jump ahead. And this slide is just to show that it also is protective to adolescents. And I know that some of the concerns around the vaccine is children experience more mild illness, but this is a case control study. So they looked at both cases and matched them to a control group of kids who weren't vaccinated. And they found when they looked at all the hospitalizations, 97% were unvaccinated compared to 3%. And of the vaccinated adolescents who were hospitalized, none required intensive care. So again, this just shows the protection offered for vaccination, even among a younger adolescent population. 30% of the adolescents in this study did not have any pre-existing condition or a chronic disease. So one of the probabilities of having an adverse outcome if you're an adolescent is having a chronic condition like obesity, diabetes, hypertension, and asthma, which fortunately in Marin County, we have lower rates of compared to the South and other parts of our country. But 30% of the adolescents who were hospitalized had no pre-existing condition and were healthy young adults prior to getting infected with COVID-19. So I think that's just an important part of the research contributing to our body of evidence about this disease and how it behaves in children and adolescents. Jump ahead. So this is just a quick 3 slides, just sharing information about the vaccine itself and the study itself. So there's 3 phases of the study. The first phase is to find the right dose. When we saw data from the 16 to 25-year-old population, as well as the 12 to 15-year-old population, we saw they had a much stronger immune response to having the 30 microgram dose. So what Pfizer did is they looked at a smaller group of kids as part of their initial study, the phase 1 study, and gave them different doses, a 10 microgram dose, a 20 microgram dose, and a 30 microgram dose. And they were looking to see how many antibodies did they produce and what did the side effects look like. So it's just it was a small group of children, I think around 400 children participated in this phase 1 study. And you can jump ahead. And thanks to Dr. Ruel for making these slides. I liberate them at many presentations. So this slide looks busy, but what it's doing is looking at the different side effects that as part of getting a vaccine. And so with a vaccine, you will get side effects. My son had a headache for a day in addition to his sore arm. So the first row, you're going to see the side effects from dose 1. The second row, you're going to see side effects after dose 2. And then you're going to see the different dosages that were given in each vaccine group. So 10, 20, and 30 micrograms across. So if you look at that first column, you're going to see fever. So few kids who received the first dose of any level from 10 micrograms to 30 micrograms had fever. But if you look at the second dose, children that received the 30 microgram dose, 100% of them had fever. So this would be considered a side effect that indicated that maybe we should go with a lower dose. Then you scroll over to look at muscle pain. So in that first dose, the children who received 30 micrograms, 100% of them had muscle pain, but only 12% who received the 10 microgram dose had muscle pain. So again, as part of the research, we're trying to find that right fit where it's produces an immune response as well as having few side effects. And so you can jump ahead. So they picked the 10 microgram studies and then they increased the size of the study. So there were over 3,000 children who received the vaccine itself, and over 1,500 kids received the placebo. And so when they looked at the antibody response, they compared it to the antibody response measured in 16 to 25-year-olds who received the 30 microgram dose. And they found that kids who received the 10 microgram dose actually had more antibodies produced than study participants who received the 30 microgram dose. So that really reassured us that it is an immune promoting vaccine. We also are seeing, is it effective at reducing the risk of COVID-19? And so over the time period of the study, they found that 17 cases in the placebo group, and remember this was a smaller group of only 1,500 kids, developed the COVID-19 infection during the study period, and only 3 kids in the vaccinated group developed COVID-19 infection, which is equivalent to an efficacy of over 90%. During the study period, there were no deaths. There was no reports of myocarditis, which is a concern in the adolescent group, especially young male group. No reports of anaphylaxis, and we didn't see any events of anaphylaxis during our first weekend. And the most common side effects were fatigue, headache, and diarrhea. But diarrhea was the same, was reported almost in the equal groups with both the placebo group and the vaccine group. You can jump ahead. So we have more vaccines coming. So you go to our website, getvaccinatedmarin.org, and you can find an appointment. This weekend, we're going to be at Strawberry Point. We're also going to have appointments available at the Northgate Mall again. And then the weekend prior to Thanksgiving, we'll be at Nevada High School. So again, a special thanks to all the school districts and schools for hosting us. They make it a really fun event. There's some therapeutic dogs and really have strived to make it a child-friendly event when vaccines can be frightening for kids and for moms. So you can jump ahead. And we're also partnering with schools to have prioritized vaccine access. And so some of our lower income schools. And so again, gratitude to these schools for their partnership. We'll also be out in West Marin, which is more geographically remote. And then we're partnering with the Office of Education again to have a special sensory clinic. So children with special needs will have a smaller, more intimate environment for vaccination. So again, grateful to all of our partners listed. All right, and do you want to pause for any vaccine questions, or if there are any vaccine questions? All right, I'll just keep rolling. So holidays are coming. This is an important time just to take stock in how you're planning and preparing for your holiday gatherings. We're really recommending that everyone who's eligible will be vaccinated, not only for COVID, but for flu. And if you're an older adult, also get your Pneumovax. Stay home if you're sick. One of the most frustrating things we see is when people go to school with symptoms that they're just are kind of blowing off, and it's better just to stay home if you're sick and get tested. Wear a face mask, especially if you're mixing with vaccinated and unvaccinated groups indoors. Try to keep it small. There is no longer a limit to gathering, but we do recommend keeping it smaller. That will decrease the risk of COVID-19 transmission. If you can, if it's nicer than today, go outside. COVID really does not like the outdoors. It's not its preferred environment for transmission. And again, just mentioning what we didn't have last year is just access to testing. So we would recommend people getting access to some of those home-based testing kits. You can test on the day of gathering, and anyone that tests positive, we would recommend that they stay home because you don't want to spread the disease among others. And then also testing 5 days after you have a gathering, especially if you're mixing with unvaccinated individuals. It's remember up to 50% of people infected with COVID-19 can be asymptomatic. And that does not mean that the next person that you pass it to, if you're an asymptomatic person, the person you pass it to can have a more severe symptoms related to COVID-19. And again, just another pitch for hand washing, which has fallen by the wayside by many. So load up your hand gel and start practicing your hand washing again. Jump ahead. This is just travel guidance. We're going to run through domestic guidance and international guidance. If you are traveling, I really recommend going to the CDC website. They have changed some of their policies around returning to the United States after international travel. So make sure you go to their website. It's the most up to date, and they just updated it this week. We do recommend delaying domestic travel until you're fully vaccinated. But if you're not fully vaccinated and must travel, we recommend that you do test 1 to 3 days, even if it's domestic travel, before you go. So you know you're not bringing COVID with you to wherever you're going. Wear a mask as required while you're traveling. And remember, in California, if you're unvaccinated, if you're in an indoor public setting, you need to mask. And then importantly, after you travel, we would recommend that you get tested 3 to 5 days after traveling, and then to stay home in quarantine. The only persons who are excluded from the quarantine requirement are students who are allowed to be on a modified quarantine returning from travel, but they must get tested on day 5. You can jump ahead. So again, we don't recommend anyone travel internationally unless they're fully vaccinated. But if you are unvaccinated and you intend to travel, this is a big change, probably the most significant change. If you're returning from an international location to the United States, previously you were able to get tested up to 3 days before you return to the United States. And now you have to have a test completed in less than 24 hours before you return from a foreign country into the United States. It's important to note that testing requirements are not for children under the age of 2. After you arrive in the US from international travel, we again recommend you get tested 3 to 5 days afterwards. Monitor for symptoms and stay home. And then also you should be quarantining at home for 7 full days after travel, even if you've tested negative in the 3 to 5 day range. And so we know many people are not following these quarantine recommendations, which is why we continue to see COVID-19 activity after travel. And again, students though, this is an exception again, because it's critically important for students to stay in school. Students who have returned from international travel can return to school. They must wear a mask indoors, and then they must get tested on day 5 to stay in school. And of course, if they develop any symptoms while in school, they should leave school immediately and get tested for COVID-19. Jump ahead. And this just shows that if you are fully vaccinated, you can get a test prior to returning to the United States up to 3 days before your departure from a foreign country. And you just need to be able to show the proof of your vaccine. So California has a program, the digital vaccine record, where you can download a copy of your vaccine I recommend checking that out. You can contact us at COVID-19vaccine@marincounty.org if you do not find your vaccine record in the digital record. And we also recommend before you travel to take a picture of your vaccine record and have that on your phone too. Also take the copy of the vaccine record itself. So, and then even if you are fully vaccinated, if you've traveled internationally, especially where there's significantly lower rates of vaccination, we would recommend that even if you're asymptomatic, that you test yourself 3 to 5 days after travel and monitor for symptoms and get tested if you develop symptoms as well. I think that's our last slide.
Yeah. Hi. So Lisa, there is a question that's come up in the question and answers. If a vaccinated student has a cold and symptoms for more than 24 hours, is it mandated by the county that the student can no longer produce a negative antigen test and must produce a negative PCR or an
Mike?
alternative diagnosis? Yes.
We did
I
that one.
apologize. We already got that one.
Okay. Sorry about that.
No,
Okay.
No worries.
that's okay. That's okay. That's
The
okay.
answer is still, you don't need it can be a molecular or antigen test. But the child must be fever-free for 24 hours and symptoms must be improving to return to school.
Right. Okay, there's no other questions there, right?
Don't see.
Okay, very good. All right, Lisa, thank you so much. All right, so there we do have some participants, so we're gonna just end your evening with a short little 1.5-minute video of appreciation, because we won't see you again till after Thanksgiving. So here you go, and then everybody have a great evening.
Everybody gets a heart, everybody gets a soul, everybody gets a mind to let them know that we can be smart, and we can be kind, and we can be living by giving and loving all the time. So on the days when it's feeling tough and it seems like you don't have enough, well, let's be thankful for our friends and family and grateful for the air that we breathe and appreciate everything that we have today. Let's be generous to anyone who has less than us. It's good to be compassionate, 'cause ever since the day you were born, yeah, we've got a lot to be thankful for. Yeah, we've got a lot to be thankful for.
I love it. I just love that. So we're grateful and thankful for all of you. And we do have a lot to be thankful for sure. So especially to Dr. Lisa Santora, who has been on a call with me yesterday afternoon, already today, twice or 3 times today, and then another meeting tomorrow morning. So Lisa, I can't wait to see you in the morning.
It's a good one.
It's going to be a good one for sure. Bye, everybody.
Bye, guys.
Thank you so much. See you soon.